All right, and so everyone knows we just started recording. So first we're going to start with introductions. My name is Jenny Brodell. I'm a clinical assistant professor and a full-time employee at the University of Iowa and the University of Iowa hospitals and clinics. I specialize in speech and language, in pediatric speech and language disorders and autism.
Hi, I'm Krista Davidson. I'm a clinical associate professor here. I'm a full-time employee at the University of Iowa, and I specialize in augmentative and alternative communication across the lifespan.
Hi, everyone. Thanks for joining us today. My name is Meaghan Foody, and I am a clinical assistant professor here at the University of Iowa and also an employee at the University of Iowa hospitals and clinics. And then my specialty area is oral rehab across the lifespan, and I'm going to go ahead and get us started. So just to kind of give you a brief agenda about what we're going to talk about today, we're going to start with a brief overview and discuss kind of general principles about ethical responsibilities, especially related to clinical education. We're going to talk about the code of ethics provided to us by ASHA and review the overarching principles that fall underneath the code of ethics. After that, we're going to kind of get into the meat of the presentation, where we're going to highlight individual rules that fall under those overarching principles and present some ethical dilemmas, which will be discussed first in breakout rooms, and then we'll kind of debrief together as a whole group. And then at the end, we'll give you some kind of take-home messages and concluding thoughts and allow some time for questions as well. So this talk is going to specifically discuss ethical decision-making in clinical instruction. So as a clinical educator, we need to make sure that we and our students are both well-versed in the ASHA Code of Ethics. And it's important to think about, it's kind of infrequent that students are discussing the ASHA Code of Ethics in clinical-based settings. This largely happens in classroom environments. However, when they've graduated and they're practicing and, they're required to make their own ethical decisions, that's going to happen in clinical settings. And so it's our responsibility as clinical educators to ensure that we're providing them with opportunities for reflection and discussion of ethical practice in clinical appointments or directly related to those clinical appointments. Ways that you can go about doing that is to incorporate reflection related to ethical decision-making throughout your clinical instruction. And we can do so by presenting them with reflection questions and feedback or in meetings with them, and then giving them opportunities to really explicitly discuss ethical decision-making and how it impacts them. We also want to make sure that we're seeking out opportunities to highlight and direct students to the ASHA Code of Ethics. So as appropriate, you might be able to ask them to look up a specific principle and review the rules that fall under that principle to reflect on where they see applications in their own practice and kind of current cases that they're working on. And then it's also really important to make sure that we are balancing our responsibilities as a provider to the clients that we're working with, as well as with students. And to remember that as licensed professionals, we have obligations for ethical decision-making, not only to ourselves as clinicians and to our profession, but also to our clients, and that we make sure this remains at the forefront of our practice when we're working with student clinicians. So the ASHA Code of Ethics is our governing body's framework of principles and standards of practice. The most updated or current model was finalized in 2016. If you are an ASHA member or an ASHA certified professional, it is your responsibility to make sure that you are working and practicing under these guidelines to make sure that you are an ethical provider. And then as a clinical educator, it's also part of your responsibility to make sure that you are educating your student clinicians related specifically to ethical standards. So we're first going to talk about the principles, and then again, we're going to kind of get into sub rules that fall under these principles a little bit later. So principle 1 states that individuals shall honor their responsibility to hold paramount the welfare of persons they serve professionally or who are participants in research and scholarly activities, and they shall treat animals involved in research in a humane manner. So there are a multitude of different rules that fall under this overarching principle. Some of these are the expectation of competent service delivery, making sure that we're exhausting all resources for the sake of quality service delivery to the patients or, clients that you're working with, to make sure that we're not discriminating in any way on the basis of sex, gender, religion, gender identity, sexual orientation, age, anything that falls under someone's kind of personal attributes or associations. And then to make sure that we're maintaining timely records also falls under this category. So quite a multitude of different expectations fall under principle 1. But to me, kind of at the end of the day, as patient-centered professionals, we are responsible for the quality of care that our clients are receiving. And this is what principle 1 really kind of holds us to. So principle 2 states that individuals shall honor their responsibility to achieve and maintain the highest level of professional competence and performance. So again, kind of rules that are more specific underneath this principle are making sure that the services that you're providing fall within your own scope of practice, depending on what area you're practicing in, whether that's speech language pathology or audiology, making sure that we're complying with institutional, state, and federal guidelines that are laid out for us. And then having a commitment to lifelong learning. So as we all know, regardless of how long you've been practicing, this is a field of, continually changing and evolving practices, research, technology. And it's important that for us to provide the best quality of care, that we are committing ourselves to making sure that we're staying on top of those things and incorporating them into our practice. And then as clinical educators, making sure that we are raising awareness to our students that they're going to have to do this currently in their state as a student clinician, and then when they graduate and are practicing independently. So principle 2 draws on the fact that it is our responsibility to make sure that we're holding ourselves to a standard of providing exceptional levels of care to our patients. And this requires us to maintain a level of professional skill that we're also sharing with student clinicians. Principle 3 states that individuals shall honor their responsibility to the public when advocating for unmet communication and swallowing needs. So again, kind of rules that fall under this principle include avoiding conflict of interest, making sure that you're not misrepresenting levels of training and or expertise in your own practice, making sure that you're not providing any kind of fraudulent behavior related to payment, reimbursement, grants, contracts, etc. And then making sure that your statements to the public adhere to prevailing principle and professional norms and don't misrepresent what kind of services that you're delivering. So principle 3 draws on our responsibility to make sure that we're representing ourselves and our profession appropriately and with a level of integrity, and also instilling those beliefs and values in the student clinicians that we're working to train. And our last principle is principle 4, which states that individuals shall uphold the dignity and autonomy of the professions, maintain collaborative and harmonious interprofessional and intraprofessional relationships. And so again, to kind of highlight some of the rules that fall under this principle, it states that individuals shall work collaboratively when appropriate with members that fall outside of your own profession, as well as members that fall within your same profession. So if you're providing services in an outpatient setting, making sure that you're working with individuals that treat those same clients in a school-based setting is a common example you might come across. Making sure that individuals who fall under our supervision don't engage in any practice that violates the code of ethics, and making sure that the individuals that you're working with are also working in a way that promotes and values ethical decision making, and that you're taking steps when you do see violations to make sure that those situations get rectified. So Principle 4 kind of overall maintains that we are expected to perform within our scope of practice and seek out additional resources from other professionals as needed in order to provide a service delivery model that provides quality of care for the patient as a whole person versus just seeing our own area of service delivery through a more narrow lens. And now I'm going to hand it over to Krista, and she's going to talk a little bit more specifically about some of those rules that fall under a couple principles.
Thanks, Meaghan. So now we're going to transition into the more interactive portion of our webinar. After I review these 2 points, I will present a scenario for breakout room discussion. But first, referring back to some of the specific rules under Principle 1 that Meaghan just described. So these relate to commonly occurring situations, especially when we're working with students. So first we have Rule J. Individuals shall accurately represent the intended purpose of a service, product, or research endeavor, and shall abide by established guidelines for clinical practice and the responsible conduct of research, which essentially means fully explaining diagnoses and providing realistic and comprehensive information at an accessible level for clients and their caregivers. We have Rule L. Individuals may make a reasonable statement of prognosis, but they shall not guarantee directly or by implication the results of any treatment or procedure. And so this means discussing possible outcomes founded in research and clinical expertise without providing guarantees related to progress. So we regularly teach and reinforce these concepts with student clinicians as we review cases and introduce new clients to them. And then the students will in turn communicate about diagnoses and prognoses with clients and caregivers. All right, so this is our first breakout discussion. This is our first scenario. So I will go through it, and then you're going to be assigned to a breakout room to discuss the ethical implications of this scenario and how you might help a student clinician work through it. Then we'll come back and discuss some of the main points in a larger group. So you and your graduate clinician are working with an 18-month-old client who was recently added to your clinical caseload. The child wears bilateral cochlear implants, which he received at a nearby medical center. When discussing goals and objectives based off your assessment findings, the parent tells the graduate student she thinks those goals are too low because the team at the medical center told me she should have 50 vocabulary words by now. How would you handle this situation? So slide. Which talks about Principle 2 and Rule D, which states individuals shall enhance and refine their professional competence and expertise through engagement in lifelong learning applicable to their professional activities and skills, which basically means recognizing our professional biases in order to ensure that families and clients are given all potential intervention strategies and approaches to make the most well-informed and individualized decision. It's important that we remind students about the necessity of lifelong learning, but also that they're going to run into professionals with more limited knowledge in certain areas. So our next breakout discussion revolves around this point. This is your second scenario. The graduate student clinician you supervise is currently working at 2 different placements. She tells you about an 8-year-old client with cerebral palsy and dysarthria at her second site who would clearly benefit from AAC, or augmentative and alternative communication. The student says the supervising SLP told her she doesn't do AAC and continues to only address oral speech production. How would you handle this situation? So you'll join your breakout room to discuss how you would advise your student, given what you know about the Code of Ethics. And then we'll bring you back for the larger discussion.
All right. So we are going to be moving into principle 3, and a commonly occurring dilemma that we see now is rule E, something that aligns with rule E. So individual statements to the public shall provide accurate and complete information about the nature and management of communication disorders, about professions, about professional services, about products for sale, and about research and scholarly activities. So we were thinking that, especially with the rise of social media and access to information, ease of sharing information, it can be really easy to fall into these pitfalls of, using something that we see before verifying its evidence base. But essentially to us, this role means, that we're being ethical clinicians. We need to ensure that the programs or the therapeutic approaches that we're using or developing or marketing for are based in evidence. We can't overstate the efficacy of a treatment approach, and we shouldn't use an approach without first researching it. Just because something is posted about or disseminated in an invited training, just because an approach or a program has funding and resources and it's presented in a visually appealing way, doesn't always equate to the best available practice or the highest evidence base out there. So we really want to emphasize to students that they soon are going to be responsible for navigating these waters when they're out practicing. They're going to be asked by other individuals, by parents, hey, I saw this post. I'm thinking about trying this. They might engage in some of those things on their own to try to save time. So with that, we have a scenario that kind of goes into the social media realm. So in your weekly planning meeting, your graduate student shares ideas for a therapeutic approach that she saw posted on her favorite Instagram SLP's page. You know that this approach does not have a strong evidence base. So we want you to talk in your breakout rooms about how you would support the student in balancing time-saving planning strategies with maintaining ethical standards of evidence-based practice. Into principle 4, the last principle, we're going to discuss a concept that I'm sure we all as practicing clinicians have faced probably on a daily basis, which is collaboration. Rule A in principle 4 states that individuals shall work collaboratively when appropriate with members of one's own profession and or members of other professions to deliver the highest quality of care to their patients and clients. So basically, plainly stated, inter and intraprofessional collaboration is central to the success of our clients. We want to be treating our clients and our patients as a whole person, not just, the speech and language things that we see in my clinic or at school or in the hospital. So this is really a necessary part of our clinical practice, and we want to make sure students are engaging in this. Everyone here on this call knows that that's much easier said than done. For many reasons, there's differing philosophies and priorities depending on the provider. There's geographical and time constraints to meeting and talking with others. It can be challenging just at a basic level to get authorization from caregivers or patients. And sometimes it can even be challenging to get reports from caregivers and patients that they're seeing other providers. But regardless of all of that, we really need to hold paramount the client's care. And so for many of our clients, that means including others in the planning and treatment process. So our last situation we're going to go through, it's a little bit more complex, or I guess just longer. You and a graduate student see a 10-year-old child with autism and intellectual disability for a follow-up evaluation. This child does not currently have a consistent communication modality. Through parent report and documentation review, your student sees that this child receives school-based and outpatient SLP services and behavioral therapy, all of whom are using different communication modalities. So one is using PECS, one is working on imitation of verbal speech, and one is using a high-tech device in sessions. And parents report to you that they are concerned with collaboration between the providers. So how would you coach your student to navigate this situation and to think through the different considerations at play here? Just to tie everything together, we really wanted to emphasize that most situations we encounter are going to be ethically gray. It's rare, right, that we come across these blatantly unethical situations where we know every single factor, and it's very easy to determine that an ethical injustice has been made. Usually these situations are gray. We really need to teach students to recognize the complexities within these situations. And first, just to point out that the situations they're encountering are complex and they are gray, and that more thought needs to be put in before jumping to conclusions. We need to teach students to consider variables, to ask questions, to seek perspectives from all involved as they navigate a path forward. We know a lot of this information we talked through is not, brand new information, but we wanted to leave you with a reminder that as clinical supervisors, we're not only expected to be ethically responsible clinicians, we have to support the development of ethically responsible future clinicians. So that means supporting our students in becoming ethically competent clinicians. We want to thank everyone so much for coming and attending this talk today, and we hope you found something beneficial, if nothing more than just a reminder that this is something we need to do with our students.